I feel like being from a Punjabi background as well, there's always that sort of, there's nothing wrong with you, just deal with it. So I've been diagnosed with dissociation disorder. And it's something that sort of comes under the branch of anxiety. It's like anxiety just reaches out to so many different branches, and this is one part of it where I get sort of feelings of dissociation and sort of a lot of numbness.
So how would you explain that further? So like, what's actually like experiencing that?
It generally feels like I'm watching myself all the time when I get it. So it's not a constant thing, it will sort of come in waves. And it literally feels like I'm sitting in the back of my head watching myself.
So like, when does that exactly take place?
There's certain triggers for it that I now have sort of noticed and will avoid or just know how to handle. But for the most part, beforehand, it was whenever and wherever. There wasn't any particular time. I just feel it sort of coming on, and I just wouldn't know what to do.
Could you talk us through like an example of maybe the first time you ever experienced that?
It's something that I've been having since I was a kid, like very young, sort of like 10ish, but I didn't know what it was then. Back then it was, I thought I was just zoning out, you know, like when you're just thinking all that, but it just didn't stop. And I thought it was normal back then, but then when it got to uni, it got much worse. Mostly a lot to do with, now I know that it was a lot to do with stress and just general, like everyone's different here.
So how does that affect your day-to-day life?
Physically, I'm completely fine, so I've had it while I'm driving and things like that. I'm aware of my surroundings, but mentally I just feel very sort of trapped and numb. So when I'm getting my dissociation, I feel completely disconnected from sort of reality. And like I said earlier, I don't feel like myself. I don't feel like I'm in myself. I feel like I'm just watching a movie of myself. Some physical stuff that I've noticed is when I'm in sort of busy places, that's one of my triggers. Loud places, that's another trigger. When I'm getting it, I don't like looking at my reflection. It just, for some reason, really freaks me out. I can't see myself in the mirror. It's kind of hard to grasp at first, but if I'm getting my dissociation and I look into a mirror, it just freaks me the hell out. Like, I don't feel like that's me in the mirror.
Where was the point in your life where you thought that, okay, this is turning into something else now, I need to kind of see what this is, I need to go get it checked out?
To be fair, I didn't even reach out for it. I went to the doctors just for something else. And then at the end of the appointment, he said, is there anything else? And that's when I was like, oh, go on now, I may as well just say something now. And that's how that began. And then from then, he sort of referred me to whoever else and gave me my sort of treatment.
So how do you cope with dissociation disorder? Like, do you take any medication?
No, I'm not on any medication. I prefer to keep it that way. So I've been speaking to multiple therapists where it was hard at first because I'd speak to someone, they wouldn't really know what's happening, they'd pass me on to someone else because it's not too, like, from what I've known and researched, it's not too common. But I finally am now speaking to someone who's, I could genuinely say, has helped me a lot. He's proper on the ball and he's given me sort of different techniques, grounding techniques and different things I can do. Things about acceptance rather than avoidance, just to sort of accept what I'm going through rather than avoiding it and just sort of shoving it under the carpet.
Would you be able to talk us through one of the techniques?
Yeah, so the first one he said, and the most effective thing I found is grounding technique. So when I'm about to get my dissociation, I can tell that I'm about to get it. So I'll have a feeling, it feels like there's like a cloud looming over me kind of thing. So as soon as I know, I use something called grounding techniques, and he said it's some 5, 4, 3, 2, 1. So it's 5 things I can see and I name them out loud. So and then 4 things I can touch, so feel different textures, just to bring me back kind of thing. 3 things I can hear, 2 things I can smell, and 1 thing I can taste. So once I go through that, and I'm like, I look at different, like 5 different things, and by the time I'm sort of on the hearing bit, I'm already back. It sort of snaps me back straight away, rather than letting me drift off, basically.
I think that is actually a really effective technique, because all you're essentially doing is just maybe bringing your senses back to the present, opposed to maybe rely on any other kind of medication to do that for you?
Yeah, definitely. I feel like when I didn't use it, I would just drift off and never have anything to bring me back. I noticed a few times like I would naturally just reach for like just want to feel like some kind of text just to bring me back kind of thing. And then when I explained that to the therapist I speak to, that that's exactly what you're meant to sort of be doing. So just to snap, when you're going through that kind of stuff, just to snap back to reality basically.
Do you feel like the more you practice this technique, the less you maybe wander off, or?
So when I spoke to him, he said, don't just do it when you're about to get your dissociation, do it just generally. So I started doing it generally, like even if I was completely okay, I started doing it, name out 5 things, feel different textures, etc. And like, okay, explained it. After that, it just became natural to me. So when I get that feeling of, okay, it's looming, I'll just do it straight away, so I'll know it, okay.
How is it like you speaking about these kind of things to your friends and family?
Family was hard, mostly because no one really understood. So when I first spoke to my family about it, and this isn't their fault, but they did kind of sort of make kind of like fun of what I was going through. They were like, "Oh, are you here?" kind of thing. At the time, it was like I laughed it off, but after that, I would think to myself on my own, like is there actually something wrong with me? This kind of thing. Am I just overthinking? Blah blah blah. And, but yeah, as I actually spoke to them and they found out that okay, this is a real thing, that's when they did ask more questions rather than just assume stuff. And like I feel like being from a Punjabi background as well, there's always that sort of, there's nothing wrong with you, just deal with it, like bunda bun, as we would say, like man up kind of thing. So
how do you feel about statements like that? I should just man up with things, you know?
To some degree, I do get it, because sometimes you do just have to get on with stuff and not let it get to you too much. But things like this, where people don't know what you're going through, kind of thing. Like if you see someone with a physical, I don't want to say disability, mental disability, but if you see someone physically where they're not capable of something, then you can tell like, okay, that's what they're going through. You can see what the difficulties are. But mental, no one knows what anyone's going through really unless they talk about it and you understand it. So for people just to assume that, sort of say the sort of dismissive kind of comments and stuff, it's hard, but it's just something I was going to deal with.
What would you say to other people going through the same thing as you are?
Talk to your friends, 100%, because I feel like friends are easy to talk to than family sometimes. Obviously do talk to family as well, and just make sure the ones closest to you understand, because that's what really helped me. The ones close around me, like my friends, like I've spoken to you multiple times, when I started getting my dissociation, they now block. So now my sister especially, she'll know exactly when I'm going through it, and she'll know what to do. If I'm going through it, I don't really like people talking to me too much, coming like too close to me, because I just feel really trapped. So she knows to just leave me alone for a bit and I'm okay. And that slowly has, like my friends now know, my family, like my mum and my sister, they kind of know as well. So I think just speak to someone, and family and friends first, and then go from there. Don't feel pressured to sort of get treatment, but I would definitely 100% recommend speak to a doctor about it. So I spoke to someone called Talking Therapies, which is an NHS, one of the NHS sort of organisations, and they are super helpful. They went through all the steps with me. They passed me on to whoever I need to be referred to, etc. So because that was anonymous, that was a huge help for me actually, because it wasn't, I did it before, it would feel like I'm putting a burden on someone. They need to listen to me. That's why I never spoke about it. Me personally, that's why I didn't. But with that, because they don't know who you are, you don't know who they are, you just let it all out. They answer your question, you answer their questions they have, and then they work around and see what they can do.
I think it's, I don't know why it's so helpful, but I think it's definitely like comforting knowing that the person that you're speaking to on the other side, because they don't know you, there's hardly any judgment there, you know?
Yeah.
And like I feel like that plays a big part to play. But what would you say to people that know nothing about this and today's their first time hearing about it?
Honestly, just do some research, and just try not to assume things, because I feel like a few years ago when I was going through it a little bit worse at uni and stuff, mental health and it wasn't too big of a topic, whereas I feel like now people are more sensitive to it now, especially because of social media and stuff. But I would say just basically try not to judge people really, like I said about the physical disability compared to a mental one. It's something that you can't see, you don't know what someone's going through. So just take a second, step back and think about put yourself in their situation.